Hello and welcome to New England Authors. So good to have you. We're trying to bring on people on this show that can be very helpful to us, and today we have that such person. Best known for his work on child and adolescent development and mental disability in low-resource communities and his development in the field of global mental health. Professor Vikram Patel is the Pershing Square Professor of Global Mental Health in the Department of Global Health and Social Medicine at Harvard Medical School. He is also the founder of Sangat, an NGO working on mental health in India, and he was named among the top 100 most influential people by Time magazine. Welcome to the show. It's so good to have you. And we have a really interesting book you wrote called Where There Is No Psychiatrist. Does this book follow Where There Is No Doctor?
Yeah, of course it does.
Yeah.
I think those of us who've been working in the area of health in low-resource settings consider Where There Is No Doctor almost like a Bible.
Mm-hmm.
But unfortunately, Where There Is No Doctor has almost nothing on mental health in it.
Right.
And so I thought there was a real gap for people who wanted to address mental health problems in such settings. And so, yeah, I was inspired by Where There Is No Doctor, and here there is Where There Is No Psychiatrist.
So who is this book intended for?
It's intended for really anyone who is passionate about helping people with mental health problems recover, indeed also helping people prevent mental health problems from occurring in the first place in settings where there are no mental health professionals. Having said this, I actually think this is a book for everyone in every setting, because many of the ideas in this book are really driven by the thought that mental health is everybody's business, not just that of mental health professionals.
Yes, so I got the feeling that you wrote this for people in, say, poor countries, right? I found it fascinating. It was like mental health 101 for me. It was like psychiatry 101. It was very helpful in finding out what all the different diseases were and so on. And you intended it mostly for people in poor countries.
Well, you know, the truth is, I'm really happy to hear you say that,
Yeah.
Kameel. It was intended primarily for frontline workers,
Yeah.
community health workers, nurses working in primary healthcare centers, potentially other kinds of providers like prison officials, police officers, teachers. But what is really nice to hear you say this, when you say this, what makes me very happy is that it's also perhaps a manual that could reach out to ordinary people who are not necessarily in a caring profession.
Yeah, it's very clear. What is nice about this book is it's very clear about, very straightforward. It's not like reading jargon. It's very clear. And you co-authored with Charlotte Hanlon.
Mm-hmm.
Please tell us about her.
Yeah, of course. It's a pleasure to talk about Charlotte. Charlotte's one of my mentees, in fact. She is a much younger person. She's a psychiatrist who has spent most of her recent life in Addis Ababa, where she is a professor in Addis Ababa University. And I thought, as I have become more and more removed from the front line in my academic role, it would be really helpful. This is the second edition, by the way.
Yes.
And so for the second edition, I thought it would be good to invite a psychiatrist who's actually working on the front line, and especially in a low-resource setting that I'm not familiar with. So I invited Charlotte, who works in Africa and is a proper, as it were, clinical psychiatrist.
Now, it's good you said that it's the second. The first edition came out about 15 years ago,
That's
right?
correct.
What's changed?
A lot has changed.
Yeah.
A lot has changed mainly because the field has transformed in the last 15 years. First of all, global mental health as a field did not exist 15 years ago. It only really emerged about 10 or 12 years ago. But I think the biggest change really is in the evidence on how frontline workers and indeed ordinary people can deliver psychological and social interventions for a range of mental health problems, from autism all the way through to depression and so on, in diverse settings, and do this very effectively. Let me say this. When I wrote the first edition, I was driven by the where there is no doctor ideology.
Right.
The second edition is grounded in science.
Oh, interesting. Interesting. I want to read the first sentence of your book. There is no health without mental health.
Well, absolutely. I think the biggest disservice that biomedicine has ever done to health is by separating, splitting off mental health and physical health. Mm-hmm. This has, of course, had ramifications right the way through history in terms of how healthcare is organized, but also in the very perception of mental health as being somehow less important or insignificant when compared to physical health.
Now, I've traveled a lot in poor countries in Africa and Asia, and when some places have no clinic, some villages have no clinic, and some places where there is a clinic, there's a line out the door. Mm-hmm. Now, when you're asking people to think about mental health as well, depression, anxiety, which you cover, are very prevalent in the world. It takes a lot more time than to cure somebody who has high blood pressure, needs some statins or whatever. How could you deal with that when you have these healthcare workers who are overstressed mm-hmm. by, yeah?
I think that's a very important question. Mm. My sense is simply because you require a little bit more time in order to address such a pressing health problem, the solution can't be to ignore it. The solution must be to figure out other ways in which you can harness resources. And one very important way is to remember that most people who deliver mental health care in this and who follow this manual are actually available in plentiful numbers. I believe that everyone in every community could be a mental health provider, for themselves to begin with, of course, but also for their loved and near ones. These individuals are not necessarily working in the formal health workforce. So let's empower ordinary people with the necessary skills to protect their own mental health and to support those that they live with. Next, let us give skills to people who work in the frontline workforce. Community health workers, for example, are plentiful. They cost much less than doctors, and they have a lot more time, actually, than doctors to provide healthcare interventions. That is, in my mind, the frontline of mental health care in the healthcare system.
Mm. Now, Paul Farmer, the great Paul Farmer, who wrote the introduction to this work, notes that where there is not a psychiatrist, the low and middle income countries are home to more than 80% of the world's population, yet receive no more than 20% of the share of mental health resources. Yeah, your book wants to change that, right?
Well, because I believe that actually, if you count mental health resources as being only psychiatrists, psychologists, and other mental health professionals, then that statement that Paul makes is absolutely correct. My book seeks to reimagine what a mental health resource is by making everyone potentially a mental health resource. If you empower people with knowledge and skills and obviously in some circumstances adequate support in the form of community health workers, etc., then I believe virtually every community in the world is adequately resourced for mental health care. And actually I think Paul would argue this is also true for other areas of healthcare, not just mental health care. The real fundamental problem in my mind has been the medicalization of healthcare to the extent that we have essentially given up our control over our own bodies and our own health to this industry of doctors and hospitals. I believe books like Where There Is No Doctor teaches us that a lot of that can be reclaimed by ordinary people and should be reclaimed.
Yeah, I really recommend this book. You don't have to live in a poor country to get a lot out of this book. And so, can you define what mental health is? I have a definition here. Do you want me to read it?
Yeah, please do.
A problem experienced by a person which affects their emotions, thoughts, or behavior, which is out of keeping with their cultural beliefs and personality, and which is producing a negative effect on their lives or the lives of their families.
I'm sorry it's so long-winded.
Yeah.
But you know,
give us the short answer.
So you know, before we think of what mental health illness is or mental health problems are, we have to think about what is mental health.
Yeah.
For me, mental health is the very essence of my personhood. You strip away my physical self, my skin, my bones, my hair. What's left of me is essentially what I define as my mental health. It's my everyday experience of the world around me, including the world within me. When that is impaired in any way or form, and that impairment affects my daily life, my ability to be productive and enjoy the life that I have around me, then I believe I have a mental health problem. If it persists for a significant period of time, doesn't resolve as it often does with help and support from our loved ones, with common sense things that we can do every day, but if it doesn't, then I believe you have a clinical condition, a mental disorder, which then needs a clinical intervention.
So that goes right into my next question. You have golden questions to detect mental health and problems. Do you know what they are? Give it to us.
Well, for me, the most important question, it's not a question, the most important thing we need to do as human beings is to ask someone who we believe may have a changed appearance, behavior, a way of talking, a way of interacting. Hey, what's going on? Just that question, I think, is the golden question. Is something the matter? Is something bothering you? Now, of course, that might sound a little too simplistic for a physician or a nurse. So therefore, we then construct more specific questions. Like, for example, have you been having negative thoughts in the last few weeks? Have you not been sleeping well?
Right.
Have you been feeling extraordinarily tired? Have you been losing interest, etc.? But actually, to be honest, if every doctor and nurse simply asked every patient, something been bothering you recently? My sense is you probably open the doors to a mental health problem if one existed.
Yeah, I worked in massage therapy at an expensive place once, and the biggest problem that rich people had was sleeping disorders. I thought that was very interesting. Yeah.
Well, that's a kind of sleeping disorders can often be because of a mental health problem. Not always, but very often they are. Particularly, for example, depression is a great example of a mental health condition that profoundly affects sleep. Obviously, many substance use problems also affect sleep. So definitely asking about sleep, in my mind, is one of the most important questions to get to understand the mental health of a person.
Now, a lot of the world is suffering from wars and other stresses. This is a really big problem. Do you see, what's your solution to, besides stopping war?
So, you know, most mental health problems, not all, but most mental health problems are profoundly affected by our social environment. So, for example, war and conflict is the one that you mentioned, but indeed you could find similar examples across all mental health problems. Childhood neglect and deprivation and abuse, we now know, is a very strong predictor of mental health problems later in life. So, what's the way to deal with this? Well, obviously prevention is always the ideal solution. Yeah. If we could prevent war and we could prevent childhood neglect, we would effectively eradicate mental health problems that are a consequence of them. But that is, of course, only, that could be argued as being fairly utopian and perhaps beyond the reach of ordinary practitioners, ordinary people. We still have to pick up the debris of human beings who've been exposed to conflict, war, displacement. What is very clear from the science is that the physical injuries that you see will heal, but the mental injuries will not automatically heal on their own. Many people will recover, but there will be a significant minority who will continue to suffer the consequences of trauma for years. And we need to address that through clinical and other interventions. My book does touch on that quite a bit, but you know, clearly these are important groups of individuals. You know, what's really interesting, and I'm sure many of your viewers will know this, that more American servicemen who served in the tours of Iraq and Afghanistan have died after they returned. Yeah, I mean, you know, isn't that an astonishing fact that they have died through suicide and substance use problems? More than who died actually during the conflicts themselves. This tells us that the hidden mental wounds of war are just as poisonous to your well-being as the physical scars.
And studies show that actually it's passed on to the next generation as well.
Well, this is a very important new observation. Of course, why that is the case still remains a mystery. It's controversial as well, right? You know, the idea that you can pass on the traumas of your life to that of your children is a very controversial and difficult observation. But it's one that, the science is clearly showing is the case.
So you talk a lot also about substance abuse, alcoholism. As I said, I've traveled a lot in the world, and I've seen a lot of alcoholism, much more than drug abuse. Can you talk a little about that? Why is this so prevalent?
Well, I can tell you about a few places that I'm familiar with. This country.
Yes.
No, let's be honest. This country has perhaps one of the worst substance abuse epidemics on the planet. That a substance, opioid, is now the leading cause. It's a substance.
Yes.
We shouldn't forget opioid
Yes.
addiction is a substance use disorder, but that it is the leading cause of death in young people in this country is a matter of grave public health concern. Similarly, alcohol is a leading cause of death in many countries, including especially in Eastern Europe and Russia, for example. So why are substances often the causes of mental health problems? Well, for a start, because they can be very addictive. And I think it's the addictive potential of a substance that makes it a dangerous substance. Opioids are highly addictive, alcohol somewhat less so. But nevertheless, these are both good examples of addictive substances that can lead to mental health problems.
Symptoms can be physical or somatic, feelings or emotional, related to thinking or cognitive problems and or doing or behavioral symptoms, and imagining or perceptual symptoms. Could you tell us what this means?
So essentially, I like to organize mental health experiences into 4 or 5 broad categories. So these are the categories you just read out. For example, one category is the feeling category. How I feel, my emotional feelings. The second category is the thinking or cognitive category. What are the thoughts I'm having? The third category is how do I act or behave? The fourth category is my perceptions. How do I see the world? How do I hear the world? How do I feel the world in terms of my skin, my senses, and so on? So these are the broad categories in which I organize the experiences of mental health and therefore also mental disorders.
We're talking with Dr. Vikram Patel from Harvard University, and we have this very great discussion about this book, Where There Is No Psychiatrist. I really recommend it if you or someone you know has mental problems. So you're talking about very vulnerable people in this work, and you're asking the healthcare workers to be observant, right? They're supposed to observe eye movements, feelings, and so on. Can you describe what we're supposed to observe in other people, what healthcare workers especially are supposed to observe?
Well, I think the first and most important thing is to observe how well they respond to your questions. You can be asking someone something that has nothing to do with mental health. For example, have you had any chest pain recently?
Yeah.
By just looking at the person, by observing their eyes, their facial expression, their bodily movements, you can pick up a lot of cues. I think we do this all the time in our daily life, right? I mean, when we're having a social interaction with someone, we say, hey, something wrong, Why can't we do that as health workers? I find it astonishing that sometimes I go see a GP and the GP doesn't look at me, but she's actually looking at a computer screen because she's very busy typing in everything I'm saying and drawing up presumably some kind of additional information about me from her computer. And I'm thinking, hey, excuse me, I'm sitting here.
Yeah.
Can you look at me? Can you see whether I'm in distress here?
Yeah.
So just being sensitive to the non-verbal cues that each of us is constantly communicating with others around us is not a big ask, I think, for a health worker to be committed to.
It's also listening.
Well, of course, the tone of your voice. But then we get a little bit more sophisticated, listening to the tone of your voice. Do you show the kind of lilt that, generally when people are in a good mood they might have when they are speaking, etc. But, the honest truth is, this is not rocket science. You don't need to go through a PhD program to learn this because this is the nature of normal human interactions.
Yeah.
We just need to be sensitive to the same nuances in a clinical consult.
All right. Now, can I ask you something else? You talk a lot about medications in here, and there are many. You have an appendix about them. It's very interesting. There are names that I can pronounce. And in poorer countries, they can't get even medication for broken legs and so on. How do you expect them to get some of these very sophisticated mental medications? Is there a foundation? Is there some system that we could set up? Or?
So first of all, can I just say that you don't need the whole list of medications in my book. The
Yes.
the book basically lists all the useful medications for mental health problems,
Right.
but not all of them are needed in every setting.
Okay.
I do think a essential core group of medicines, which we do asterisk, we highlight them in the book,
Right.
should be available everywhere. It is absolutely not acceptable that someone with epilepsy should have a seizure when the medicines to control epilepsy cost a cent or two a day. It's absolutely immoral that we should allow that to happen. So I think the question isn't whether the country is too poor. The question is the world too poor to make sure that the poorest people in the world receive medications that can transform their lives? Other medicines, I would say, are maybe perhaps less urgently needed, but certainly it is not the case that all medicines for mental health problems can be left until a place is better resourced. I will say one other thing, though, that my book hopefully does convey this very clearly, is that the care of people with mental health problems is way more than medicines. In fact,
yes,
perhaps
yes.
for me, the single biggest development in our field and the biggest expansion in the book from the first edition is on the section of psychological and social interventions, where we've developed the richest evidence base on how we can deliver these interventions in the least resourced parts of the world using ordinary lay people.
All right, we're talking again with Dr. Vikram Patel, and this is New England Authors. Very fascinating discussion. I want to bring it home in the United States. How can we have better mental health here? We have a lot of people, for example, on the streets.
Yeah. So, I'm sure when some of your viewers see the cover of the book, they must think this is, out there.
Yeah.
So I have to tell you a little story. I am a new arrival in this country. I've only actually arrived in this country just over a year ago.
Really?
And interestingly, I was housed by Harvard in an apartment just a few blocks from here at Central Square.
Right.
And I remember the first evening I landed here, and the taxi dropped me at the entrance of my building, and I saw this large group of individuals who clearly didn't look well, who were essentially sleeping right outside the entrance of my building.
Right.
And it did take me a little while to figure out that actually these were individuals with serious mental illness who were having a little break from a homeless shelter around the corner. I think that was my first and very immediate introduction to the crisis of mental health care in the US. Since then, of course, I have learned a lot from my colleagues here about the vast numbers of people who live on the streets or in prisons, etc. And therefore, I do think, actually, that where there is no psychiatrist, ironically, has a relevance in a country where there are many psychiatrists. Because clearly, it isn't just the number of psychiatrists that matters, but it is how you organize mental health care that is fundamentally important. And that means empowering people at every level of the healthcare system and the social care system to be able to provide care for people with mental illness.
So we're doing a really bad job in the United States if we have
You know what? If I had to look at what you can achieve with the amount of money and people that you have,
yes.
yeah, it's a pretty bad job.
Yeah.
But that is not to say that people in the mental health care professions aren't passionate about it. I think many of us often feel constrained by the way the mental health care system is organized. And I do think this is beyond ordinary providers suddenly stepping out of their roles and doing something dramatically different. It's about how we organize healthcare more generally and mental health care within it. For example, are we really going to see universal health coverage? And that's a bigger question, a bigger debate here.
Another thing that you're trying to address, Dr. Patel, is the environmental changes that are happening, the problem of migration. We're seeing this in the United States, but other countries are seeing it much more. Refugees. This is not just an American problem. It's a global problem. So the problems of El Salvador are now in the United States, and the problems of the United States are in El Salvador. Could you comment a little bit on the global scale that we're talking about here?
Well, I think you really, described something that concerns me greatly and should concern the global health and development community as a key issue. There are major social transitions happening. Amongst them include climate change, which is creating more and more hazardous environmental events. Amongst them is the rise of an extreme nationalist view, which is creating all kinds of problems for minorities, leading to mass migrations, conflict. Amongst them is the aging of the world, which is creating, of course, a whole generation of older people with no younger people to actually help buttress a care system that used to be historically something we took for granted.
Right.
But also the emergence of neurodegenerative conditions in older age like dementia. So I think mental health is becoming an even more significant global concern in the light of these social transitions, the demographic transitions, and that we need to be prepared to address the mental health of populations. And what my book tries to do is really to democratize mental health so that it becomes an asset, something that each and every one of us should treasure and value, not just in terms of protecting and promoting our own mental health, but having the necessary skills to reach out to those around us.
And to promote a general mental health for our global
Absolutely,
environment.
absolutely. As I say all the time, mental health is too important to be left to the doctors alone.
One last question before we round off here. What's next in global mental health?
Well, I think the journey has just begun. I think the fact that the vast majority of the world's people with mental health problems still don't receive even basic care, to me, remains an affront to humanity. But what is even more egregious is that so many people with mental illness suffer such awful abuses of basic human rights, of freedom, dignity, and autonomy. To me, that is what we need to address, and that is still a very urgent and current problem.